Actually, Steven Crowder said something that I think is absolutely brilliant along these lines, which is if everyone says that the Republicans are the party of rich people, then wouldn't it be in their benefit to make as many people rich as possible so that they would continue getting voted for? And so the same would have to apply to the Democrat Party. If they're the party of the poor people, then what is in their best interest? Keeping people poor. It's just like a social worker whose job it is to help homeless people. If they help all the homeless people in their town,
They're
they
out of
don't
a
have a
job.
job anymore. And so it's not in their best interest to actually help homeless people. It's in their best interest to keep stringing them along and giving them just enough that they remain homeless, but but doing enough that they can, go to their boss or to the people and say, "Oh, but look, I implemented all of these programs. Look how wonderful I am."
That aspect is in like everything.
Everything.
Healthcare, cancer treatments, everything. They don't want to cure you. They don't want to actually help you. They want to keep you needy, independent. It's,
If
I
you're
mean,
in the
I get it.
if you're in the business of helping sick people, you would arguably want more sick people.
Right. And
Which is why they close gyms during quarantine. I don't believe that.
the
actually.
healthiest place you can go to, they close it down. Makes sense, doesn't it?
Well, that just the whole COVID thing actually just showed. Like, I'm not one that ascribes to this evil conspiracy, but it did point to a lot of questionable judgment. So, for example, I talked about this in the Fauci emails solo special. His justification for saying that masks weren't effective initially is and this is him saying it. This is not a theory. This is Fauci said this. What he wanted to do was make sure that the medical professionals had enough PPE because of they were pretty sure there was going to be an influx of patients coming into hospitals that were COVID positive.
Well, also with people fear buying, or how do you
Well,
what do you
right, but
call that?
the logic that he gave was he wanted to make sure they had PPE for the medical professionals. But if you prevent the public from getting sick by making sure they have adequate PPE and social distancing, you would not have that influx of patients going into the hospitals and therefore would not need to worry about that. It's like he's trying to solve a problem by creating another problem, but you can solve the first problem by not creating the other problem.
It's weird.
Right.
It's weird.
It's like
A doctor
they
that's
get
a
fixed.
politician.
Well, the problem is, and this is how again the right does this too, but it's been mostly the left is they fixate on an end point, and they're not considering how we might be able to do this easier, and we might be able to kill two birds with one stone. The Affordable Care Act is a prime example of that. When Obama was in office, their whole shtick was we want to make sure people are covered, and it's like, okay, but what are you going to give up to make sure that happens? When if you looked at it from a different lens, again, free thinking, which was taboo at the time, because heaven forbid you sound kind of like a Republican, and you look at it, it's like, okay, is the problem that people are underinsured or that the entire market is based on insurance? The fact that it's not even, I've said this too, it's not even insurance anymore. Like, you shouldn't need to tap into insurance to go to a regular checkup. But they've created a market that is wholly dependent on people having insurance coverage, and they've done it to incentivize people. So now, and it makes no sense because if you think about it from a purely monetary perspective, let's say your deductible for the year is $5,000. Well, you go to a doctor's office, what's that? $200? Well, your insurance isn't paying that anyway. You have to get your deductible covered first.
Right.
Or you could not have health insurance and only go to the doctor when you were sick, and you're still only out $200. The problem is that when you go to the doctor and find out you have cancer, then you need your insurance. But we've gotten things out of order. That makes sense, or was I rambling?
Oh no, that makes perfect sense. Actually, I come from a medical family, and that is like the way that it would work ideally is that you would pay for all of the small things. So you would pay for your annual checkups and stuff like that. The stuff that's going to cost you $50 to $200 or something like that. And then insurance is there for the catastrophes, for you break your leg, you get in a car crash, you have cancer, whatever it might be. You save your insurance for that, and then you'd actually have to pay a lot less for insurance because you wouldn't be using it all the time. The doctor's visits would be cheaper because they wouldn't be going through all the red tape of sending everything through insurance and all of that. And yeah, it's a completely ridiculous system that we have.